We're now joined by Dr. Shereef Elnahal, President and CEO of University Hospital, former Commissioner of Health in the great state of New Jersey. Doctor, good to have you with us.
Thanks so much for having me, Steve.
Doctor, we were talking before we got on the air. Your daughter, 5 years old, she got the vaccine, turning 6, right after we tape this program. Actually, as you said, on Thanksgiving. But let me ask you something. Why was it so important for you to do that in a public way?
Well, first of all, I want to say, Steve, that I thought it was the best thing for her safety, and her health. And it's one of the most important things for anyone to do for their health is to get vaccinated. And now that kids age 5 to 11 can do so with a vaccine that's over 90% effective and overwhelmingly safe, I thought it was important for her. But secondarily, I thought it was important for me as somebody who is talking to the community about doing the same, to show publicly that we're doing so for our own kids, my wife and I. And so that's something that's been a theme from the beginning. Everyone asks me, hey, have you taken the vaccine? Have your loved ones? So this was really important for us to have the credibility of doing that.
Yeah, I don't have the credibility you have in this arena, but our daughter on the outside end of that at 11 just had the vaccine. And I want to put that out there and people decide for themselves. Our job is to put information out there that is credible and scientific. Let me ask you this. Again, impossible to predict where we're going to be, but what do you believe that in the first quarter of 2022 we need to be looking out for and concerned about regarding COVID?
Well, the same trends last year, Steve, are happening this year in terms of more people going indoors and folks gathering again because of the colder weather. And so we will probably see an increase. However, I do not think the increase will be nearly as high as it was last year for one reason and one reason only, and that's the availability of vaccines and the fact that New Jersey's made so much progress with vaccination and continues to make progress with boosters. So I think we'll see an increase in cases, hopefully not a sharp increase in hospitalizations, and hopefully we can keep deaths down as well.
Let me do this. First, I want to disclose University Hospital, a significant underwriter of the work we do in the area of healthcare. The follow-up is this. You were one of the first healthcare leaders, first hospitals or hospital systems to mandate the vaccine. There are some who've argued across the country, how could you do this to healthcare workers? They're the ones who put themselves on the line. Now they have to choose between getting the vaccine and losing their job. How many have lost their job, A, and B? What is the response rate to the mandate at university?
Well, my simple response to that, Steve, is getting vaccinated and protecting yourself from getting COVID-19 is a fundamental part of your job as a healthcare worker. Folks have to remember that we see the most vulnerable patients and vulnerable people in the community, people who, if they get COVID-19, are much more likely to get very sick, hospitalized, or die from the disease. And so it's a very essential part of our mission for folks to protect themselves and prevent spread among our employees and, of course, spread to our patients and families. So that's why we did it.
How much progress do you think we've made, and what do we still need to do, particularly in Black and brown communities, regarding vaccine resistance, getting close to 2 years into this pandemic?
The good news, Steve, is that at least for primary vaccinations, we're seeing a significant catch-up of people of color getting vaccinated. In fact, a lot of surveys show that acceptance rates are now on par with white Americans when it comes to people of color, which is great news. However, we do still have some progress to make. And remember that our community here in Newark and Essex County was among the most devastated in New Jersey and throughout the country in the beginning of this pandemic. So all of the inequities that have been built into our society and certainly into healthcare have led to this. So getting vaccinated is all the more important for communities of color.
You know, I've asked you this before. We've talked about it offline, online as well. The misinformation out there, and some of it intentional, some of it because people actually believe what they believe and they put it out there in terms of public health, in terms of the vaccines, in terms of COVID, how sick you can be, what medicine, what works, what doesn't work. Aaron Rodgers uses the term immunized, and he was talking about other medication. Here's the point. What is the appropriate role for the media from your perspective as a public health professional in terms of making sense of all this and not having a point of view, but putting out credible health education and information? I know it's a loaded question, but I keep thinking about it.
I think it's absolutely essential, Steve, for our partners in the media to be spreading the truth and emphasizing the truth relative to the misinformation and disinformation circulating on social media. I think the media has done a great job of that. We're having this discussion right now, which is a great thing. But I also think it's incumbent upon leaders, both formal and informal, including influencers, including athletes, to also know the truth, and they can make their personal choices, but certainly they should not be spreading disinformation on social media, because that ends up harming so many more people than they think. And so I think the responsibility that we carry as a result of having influence, part of that is spreading the right information during this health crisis. And you can't really separate yourself from that as a person of influence.
Biggest plans for University Hospital in 2022 and beyond?
We're so excited, Steve. Our agenda now, after having improved quality, improved our financial performance, is growth and expansion of services. Our community is one that needs more healthcare and not less, and so that's a major part of our agenda. But something we're really excited about is a new building that we're planning for as we speak. We're about to finalize a request for proposals for a master planner. We have support from the state, we have support from local officials, and we are finally going to give the infrastructure that the community deserves and our talented workforce and physicians also deserve in serving them. And we're so excited about that.
What's that building going to be?
It's going to be right on our campus. It's going to be an entirely new infrastructure, modern, one that is commensurate, again, with the talent of our clinicians, and one that finally remakes the appearance of the campus in such a critical part of the Newark community. Remember that we are among the most poor parts of Newark. And at the end of the day, we serve the most vulnerable, and they deserve the best, highest quality healthcare and the best infrastructure possible.
Dr. Shereef Elnahal, former Commissioner of Health in New Jersey, the President and CEO of University Hospital. Doctor, thanks so much for joining us.
Thank you again, Steve.
You got it. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation. Funding has been provided by the TURRELL Fund, supporting REIMAGINEchildcare. PNC, Grow Up Great. Fedway Associates, Inc. MD Advantage Insurance Company. PSE&G, Operating Engineers, Local 825. IBEW Local 102, Lighting the Path, Leading the Way. Eastern Atlantic States Regional Council of Carpenters. And by the Fidelco Group. Promotional support provided by Insider NJ. And by Jaffe Communications.
Choosing a new family doctor can be confusing. Check with your health insurer to see which physicians near you participate with your plan. Find out which hospitals the doctor uses and who covers when the doctor is away. And remember to schedule an appointment with your new doctor in advance to fill out any paperwork without the added stress of being sick.